Cardiovascular health refers to the strength of your heart in contracting, the efficiency of your blood vessels and your circulatory system to send oxygen and nutrients to the body. This is essential for well-being and day-to-day energy, but it's also crucial because having good cardiovascular health will protect you against diseases like heart disease, stroke, and the worsening of metabolic diseases. Given this is the #1 killer worldwide, we really want to think about cardiovascular health when we're protecting ourselves against mortality, but also thinking about longevity generally speaking. Having good cardiovascular health means you have good energy, that you can get up and engage with your family in the way that you want to, and means that you can exercise and do all the things that you would like to do day to day. Longer term, it might impact, are you at risk for a heart attack, for a stroke, or for worsening metabolic diseases like diabetes, for example. The key markers for cardiovascular health include the lipid panel, which might include a total cholesterol, an LDL, an HDL, and a triglyceride level. I think ApoB is one of the most important markers that we can look at when we're thinking about cardiovascular health. It is more sensitive than any one of those individual lipid panel markers because it essentially collates the sum total of all atherogenic particles that may have impact to your blood vessels that can start an inflammatory cascade and lead to oxidative stress that will end you closer to a heart attack or some kind of heart disease situation. So with ApoB, I would, generally speaking, thinking about decreasing your consumption of saturated fat. So think about things like butter or ghee or higher fat cuts of meat. You might want to think about minimizing those. I would also really consider how much sugar in the way of processed sugar or highly refined sugar you're consuming. These things can decrease your overall atherogenic load and be protective. I also would encourage people to exercise, and that could be both cardiovascular exercise as well as strength training. So exercise has a few effects. One, you're going to help clear your lipids through the body when you're exercising more, but you're also increasing the fluidity, elasticity, and health of your vascular system. So you're less likely to be at risk when we're talking about little particles that attach and cause an inflammatory cascade. Atherogenic is maybe a fancy way of saying that there is a particle that has the ability to enter the blood vessel wall and start to destroy it, such that your body's natural inflammatory response may kick in, and even though this might be favorable in the beginning, overall can create little plaques that eventually become blockages that could put you at risk for that coronary outcome or a stroke in the brain. So cholesterol is a fat, and when we think about putting fat into water, it tends to not work very well, right? It will not actually assimilate. So lipoproteins are basically little travel molecules for your fats that allow you to move those fats through parts of your body that are more water soluble or more water-based so that we can transport those lipoproteins throughout your body. As much as we villainize cholesterol, it is absolutely essential for our function as humans. Cholesterol is the precursor to all the hormones that we have in our body. So we want a certain amount of it to be able to make estrogen and to make cortisol. We also need our cholesterol to support the membranes of our cells, because when we've got good cholesterol, it means that our cells are pliable and they can move around and they are healthy. And we need cholesterol for our brain. So a lot of neurotransmission is dependent on having enough fat in the brain to be able to do that. So these are all good things, and we want a base level of cholesterol to be able to support our function and vitality. Excess cholesterol may mean that that cholesterol ends up in your blood vessels. And when cholesterol ends up in your blood vessels, especially certain types of cholesterol, they can start a destructive campaign in that blood vessel and essentially put you in a place where you may develop plaques that turn into clots, that turn into coronary disease or strokes. It's a great question to think about the role of dietary cholesterol and our cholesterol overall. We used to historically think that this was a big deal, and you probably heard at some point, we should never eat eggs because it's really problematic for your health. But in fact, dietary cholesterol has a very limited role on what happens with the cholesterol in your body. Saturated fat, however, does play a role. Saturated fat is going to be more incorporated into the whole kind of movement of fat in your body into these lipoproteins that can then be more destructive when we're talking about blood vessels and overall cardiovascular health. The key dietary changes you can make if you have a bad cholesterol reading is, number one, be mindful about saturated fat. So here we're thinking about fattier cuts of meat, ghee, butter. So this is really important. Number two, I would think about movement and exercise, and this can be a combination of cardiovascular exercise and strength training as we're improving the strength of our cardiovascular health as we're moving. I would also really push forward fiber. All kinds of fiber is good to help bind cholesterol in the gut and help you eliminate it. And finally, I do think that stress reduction and sleep has an important role in your overall cardiovascular health. HSCRP stands for highly sensitive C-reactive protein. It is one of the most important markers when we're thinking about how to assess systemic inflammation. So that means inflammation throughout the body. In acute waves, HSCRP may elevate and be totally normal and expected. But when HSCRP is chronically elevated, this puts us at risk against all causes of mortality, but certainly specifically around cardiovascular disease. Lipoprotein a, or Lp(a), is a marker that is very genetically determined. So here we are going to find out how at risk is someone without thinking about their lifestyle or nutrition. It's just a marker that tells us how likely is someone to clot or not. This is very important to know when you're thinking about your cardiovascular risk, because if you're somebody who has an elevated Lp(a), you might want to have a more aggressive approach to managing your cardiovascular risk. As you improve your overall cholesterol panel by exercising, eating well, you can see some improvements in your Lp(a). HDL stands for high density lipoprotein. Generally speaking, this is a more favorable marker. It tends to track with better outcomes when we're talking about cardiovascular health. So higher levels here are going to be more desirable. You can actually increase your HDL by thinking about consuming more monounsaturated fats, which you may find in avocados and some nuts and seeds. HDL is essentially clearing excess lipids from the body and helping them to be removed. Triglycerides are a very special kind of fat. They're a storage form of fat. So typically speaking, we're going to have higher triglycerides when there might be excess calories around, and specifically more sugar-based calories. We really think about triglycerides because they tend to track with things like insulin resistance, and so can kind of be another marker to think about metabolic health specifically. So one way that I would recommend people improving their triglycerides is to exercise, to limit their consumption of highly processed sugar, to decrease their fructose. Those would be my top ways to think about supporting your triglycerides. So improving LDL would be in some ways similar to how you improve ApoB overall. So you would want to think about decreasing your consumption of saturated fats, getting exercise, eating nutrient-dense foods that are balanced as far as sugar, protein, and fat goes. HSCRP, as a reminder, is a systemic inflammation marker. So there are many things that may drive inflammation: stress, poor food, metabolic dysfunction. So sometimes we just have to think in a very broad way, how can we improve this? But generally speaking, eating a well-balanced diet, sleeping well, getting good exercise, and managing your stress, those are probably 4 very clear and essential ways to support your HSCRP. Sleep and stress, I would say, through that mechanism of inflammation, have a big role in your cholesterol. So the more that you have, poor sleep and elevated stress, you may have higher levels of cortisol, which then impact inflammation, which have a negative impact on your lipids. Triglycerides are actually a specialized kind of storage fat, so they may be elevated more in a situation where someone is consuming excess calories, specifically processed sugar, highly refined sugar, and it ends up getting stored in the liver as a backup reserve of energy. Unfortunately, this can be particularly inflammatory and problematic for cardiovascular health. HDL stands for high density lipoprotein, and this is a marker that tells us how well is cholesterol being removed from the body. So you would want more of this, right? Because if we're taking away cholesterol, this is positive overall when we're thinking about cardiovascular health. So higher levels here are more favorable for health. So LDL stands for low density lipoprotein. Interestingly, it is a type of ApoB lipoprotein, and it tends to be more collecting of cholesterol. So this is going to lead to the cholesterol that stays in the body, but also is able to enter into the vessel wall and create damage that can start a cascade towards disease. The liver is our body's major detoxification organ. It has many roles, including processing cholesterol, helping with protein production, managing hormones, and essentially removing all the toxins from our body and putting them into packages that are easy for excretion. A healthy liver has the ability to detoxify nutrients. It's making proper amounts of proteins. It's moving cholesterol and hormones in a proper way. And when your liver is healthy, you probably have good energy, good digestive health, and are not struggling with things like brain fog. Poor liver health may mean that your liver doesn't have the ability to detoxify, and certain digestive functions are compromised. And when this is happening, you may be more inclined to struggle with brain fog or digestive dysfunction. Fatty liver disease essentially is a combination of liver and cardiovascular health, where you may have an accumulation of storage fat that happens in your liver that can cause its own inflammatory kind of cascade, but in addition will compromise the liver's filtering capacity. So excess consumption of processed sugar, refined sugar, excess calories, and certainly alcohol as well can contribute to this. So the liver helps to make proteins. One protein in particular called albumin is very important in fluid balance, and it's also a transport mechanism for things that need to be moved throughout the body. Globulin is an additional protein that is very important specifically in the immune system. And so here we can look at levels of globulin when you're thinking about liver health to understand both the function of the liver, but also the function of the immune system. I think the most important things to look at are what's your ALT, what's your AST, what's your albumin level, and if you have digestive issues, you may want to think about what's your alkaline phosphatase level or your GGT, which may indicate issues with your bile ducts specifically. GGT stands for gamma-glutamyl-transferase, and it's essentially a marker that is very sensitive for liver inflammation and can help us understand if there's inflammation or dysfunction in the liver. It's a synthetic marker, so we understand, is there oxidative stress in the liver that's happening? It really helps us hone into what's the health of the liver tissue specifically. So when you look at the two enzyme markers, the ALT, alanine aminotransferase, and the AST, the aspartate aminotransferase, there can be certain combinations of this that may move you in one direction or another. When you look at them together, if you see a higher AST compared to an ALT, you might think more about alcohol-related damage, versus if you see a higher ALT to an AST, you might think more about fatty liver. So you could look at the two protein markers, so the albumin and the globulin, and when you see kind of low levels of albumin, you might think more about malnutrition, and when you see high levels of globulin, you might more think about an upregulated immune system. Bilirubin is a breakdown product of red blood cells. So when you see this elevated in the context of a liver panel, you may think about that, but more likely you're going to think about some kind of obstruction in the biliary tree that might cause that bilirubin to not be moving through and therefore be elevated. I think some of the main things to improve your liver health include some key nutritional things, like decreasing your consumption of processed food, decreasing how much refined sugar you're consuming, making sure you're limiting, if not eliminating, alcohol. These would be my key supports, but I also think getting fiber to push forward detoxification in the liver can be very helpful, and always sleep and stress reduction are very important. Alcohol is related to liver health because alcohol needs to be processed by the liver. And in the end, it is a toxin. And when we're consuming it at high levels, the liver has excess work to do to process it. And when done in excess, has to be stored in some place in the liver, which then impacts how well the liver can filter. Fat builds up in the liver as a function of excess calories coming in. When these excess calories in the way of sugar or alcohol come in, the body is not utilizing them. We're not pulling them forward to actually turn them into energy, and so they get put in a storage form in the actual tissue of the liver. Fructose is very important when we're thinking about liver health. So fructose specifically is going to be stored like some of these other variables that get stored in the liver. And fructose independently will worsen cardiovascular health, will worsen metabolic health, and has a negative impact when we're talking about the health of your liver. So the liver has to turn items that are not water soluble into items that are water soluble and ready for excretion. So getting enough hydration really helps the liver do its most effective job. If I had to pick one food to support liver health, I would go for cruciferous vegetables without a doubt. The reason why is the liver kind of works in two modes. There's phase 1 detoxification and phase 2. We typically all do the first phase reasonably well, but it's the second phase that we have a little trouble with. And cruciferous vegetables are very helpful to help this second phase to help us remove toxins from our body. So I would suggest Brussels sprouts, broccoli, cauliflower, cabbage, go wild on those. Cruciferous vegetables are very high in something called sulforaphane, which is the specific nutrient that the liver needs to help to remove toxins from the body. So alkaline phosphatase is a marker that is associated with the liver panel that both gives us an information on bone health, so it's involved in bone turnover, and it also gives us information about the bile duct. So when this marker is elevated, we're either thinking something related to the bone or something related to bile duct function. The bile duct is part of the liver, and it specifically secretes bile down into the digestive tract to help the digestion of fats. So the liver tree basically is a set of organs that sit near the liver that include the bile duct and connect to the pancreas, and they both kind of come together into the common bile duct that supports digestion. So first of all, non-alcoholic fatty liver disease refers to an excess of fat stored in the liver that is not related to alcohol. And unfortunately, this condition still has all the risks associated with it, where you can eventually develop fibrosis and a non-functioning liver. When we think about what drives this condition, we think generally about excess calories, but the kind of calories matter. If you're eating a whole foods diet, you're not going to struggle with this condition. But if there's excess processed food, empty calories with sugars that are highly refined, excess of food generally speaking that's not wholesome and healthy, you may struggle with this condition. So fructose is a special kind of sugar that you may find in alcohol, specifically in beer, certainly in your sodas and your sugary drinks. And when you're consuming elevated levels of these types of products, you can also drive fatty liver disease. Excess fructose in the liver essentially is thought of as an excess storage molecule, and therefore it's turned into a fat for later time, later years of consumption, and therefore it gets stored as a fat in the body. So fructose is a type of sugar that can be found in fruits, that your apple, your pear, which are great sources of fructose, but they can also be found in sugary drinks, in your sodas, and in your alcoholic beverages, specifically in beer. So when we talk about fructose, we're not saying avoid it altogether. We are encouraging you to be strategic about what kind of fructose you consume. In your whole fruits, go for it. In your sugary drinks and sodas, be mindful. The kidney is a vital organ. We have two of them, and it's essentially involved in managing fluid balance, acid-base balance in the body. It's also going to help regulate certain electrolytes that we have and support blood pressure. And finally, it's involved in red blood cell production. The kidneys will filter toxins out of the body and have a major role in eliminating toxins that need to be removed through urine. So if your kidneys are not functioning correctly, you may have imbalances in blood pressure, in electrolytes, and you may kind of symptomatically struggle with brain fog, with fluid retention, and abnormal blood pressure. Blood pressure relates to kidney health in kind of a bidirectional way. There are some things, specifically uric acid, that might actually increase blood pressure in the body. Chronic kidney disease is essentially a very advanced form of disease of the kidney where there is an issue with certain parts of the kidney in filtering items. Therefore, you'll have a buildup of either electrolytes or toxins that can be problematic to your health. Too much protein, as it negatively affects the kidney, might be like too heavy of a load at one time or too much over time consistently that might hurt the overall function of the kidney. It's more likely to happen when you're supplementing with protein powders as opposed to eating whole foods protein that would come as part of a regular diet. When I think about kidney health, I'm specifically looking at markers like blood urea nitrogen, BUN, which is a breakdown product of protein, as well as creatinine, which is a breakdown product of muscle. And if you're looking for a more sensitive marker around the kidney, you may also look at something called cystatin C, which is a marker that allows for a little bit of a kind of early look into how kidneys might be declining in function. eGFR stands for Estimated Glomerular Filtration Rate. So when you think the word rate, it's essentially giving you kind of the rate at which things are being filtered through the kidney. Here, we want to see kind of a sweet spot level that allows us to know, actually, we're moving things quite efficiently through the liver. Below 60, we start to worry that someone may have some kind of compromise in their filtration. So eGFR is a marker that kind of generally speaking tells us about filtration. Cystatin C is a more emerging marker that we're using as we calculate the eGFR to essentially have a more accurate way to know how filtration is happening, because creatinine, which is typically used for eGFR, is really dependent on muscle and muscle breakdown, and sometimes that can be variable depending on the person. So it's important to think about kidney health and specifically eGFR, because as we age, this is going to naturally decline. So you want to be strategic and get ahead of the game by making sure you're staying hydrated and thinking about your kidney health so that you can slow down that natural decline that is inevitable. Creatinine is a breakdown product of protein, and we use creatinine as a marker to assess kidney function. As this number goes up, we may be more concerned about the filtering capacity of your kidney. So creatine is a popular supplement that essentially helps hit the creatine phosphate system, which is a way that we generate energy quickly in our body. It's popular in exercise and nowadays for almost everything. It relates to the kidney in the sense that there's probably a balance on how much creatine you can take that doesn't negatively impact your kidney function. The ways to improve your kidney markers if they're out of range, first and foremost, include staying hydrated. Hydration is essential for the kidneys. Like the liver, we need enough fluid to be able to move toxins through the system and eventually eliminate it through urine. Second, you can think about balancing sugar, specifically your refined sugars, keeping your protein in that healthy balance overall, and ideally focusing on whole food sources of protein. And finally, thinking about the role of uric acid and blood pressure on putting stress on the kidneys overall. So to improve your blood pressure, you can first and foremost think about managing stress. So stress has a big impact on your blood pressure, and I would encourage people to engage in mindfulness practices to support their blood pressure systems. I would also really look into the role of uric acid in the body. Uric acid has a specific and direct correlation with increasing blood pressure in the body, and as blood pressure is increased, given our kidneys are quite vascular, they might be under more pressure and may perform more poorly as a function of that. And as the kidney performs more poorly, we're going to have a feedback loop to worsen blood pressure overall. The kidneys are the unsung hero of the body because even though they're quite small, they take 25% of our blood supply and filter out all the toxins and help balance all the electrolytes in our body. So it is essential to think about the health of your kidneys. Calcium and kidney health are connected because calcium is actually regulated by the kidneys. And without that proper regulation, you may have excess levels of calcium and or low levels of calcium, both of which can cause problems, including things like muscle contraction issues, as well as bone disorder issues and problems with the parathyroid gland. The key electrolytes related to kidney health include calcium, potassium, chloride, and sodium. They affect kidney health because they are involved in fluid balance overall, and when they are out of balance, that may affect the movement of fluid to the kidneys. As a clinician, when I'm looking at this panel, the things that would worry me would be a low sodium or a very high potassium, as these things have more kind of specific outcomes that are dangerous for somebody. So when your potassium is elevated, you might be at risk for arrhythmias or aberration in your heart contractility. When your sodium is low, this has a very serious impact on your neurological health, and it can actually be something that requires hospitalization. High potassium is dangerous because it can have an impact on the contractility of our heart and put us in a place where we may have an arrhythmia that may compromise our function. The pancreas is an important organ in the body, and it essentially has a dual function. It's going to work to help support digestive capacity, so the ability for you to digest and break down nutrients that you bring in, and it also plays a role in metabolic health as it secretes insulin and glucagon. If the pancreas isn't functioning correctly, you may have trouble specifically with digestive disorders. You may have trouble with digesting your carbohydrates and your fats, and you've got loose stools, fatty stools, and or have malnutrition because you're not getting your nutrients in well. There are a number of things that you can do to support the health of your pancreas. You can stay hydrated, you can avoid alcohol and tobacco, and you can give yourself a little bit of digestive support with things like apple cider vinegar or even papaya that give you a little bit of natural enzyme support. The two key biomarkers I think about when I think about pancreatic health are amylase and lipase. Amylase is an enzyme that's involved in the breakdown of carbohydrates specifically. You actually have a little bit of amylase that comes through the salivary glands, and it is also secreted through the pancreas as well. Your amylase might be out of range for two reasons, depending on which way it's going. If your amylase is low, you may have slowed digestive function. And when your amylase is high, especially if it's quite high, you may think about things like pancreatitis. Pancreatitis is essentially an acute inflammation of the pancreas that could happen secondary to alcohol, where symptom-wise, you may struggle with intense nausea and vomiting, abdominal pain, and altered mental status. Lipase is an enzyme that is specifically involved in digesting fat. This is an enzyme that's more specifically going to be secreted by the pancreas, so it tends to be a more marker of pancreatic function, generally speaking. When it's low, you might be seeing things like slowed or lowered digestive capacity, especially of fats. When it's very high, you might think about pancreatitis, pancreas issues, and or dysfunction in the gallbladder. The conditions that most commonly come to my door related to the pancreas are either digestive related, and so here I may see lower levels of enzymes, and it may also be accompanied by a lower level of elastase. And here this might be someone is having trouble with, reflux, abdominal pain, like poor elimination, and they may have low digestive capacity that could be kind of early term and manageable, or late term and they essentially are not digesting foods at all and are struggling with malnutrition. So alcohol in excess can essentially cause damage to the pancreas and impact digestive function, but also function generally, such that you may be at risk for acute inflammation of the pancreas or even pancreatic cancer. Good pancreatic health can be maintained by staying essentially really well hydrated, by limiting your consumption of alcohol, avoiding tobacco, supporting your digestive health with, digestive supporting foods like your apple cider vinegars, your papayas, and managing stress, as the thing that I see most commonly is that excessive stress downregulates the function of the pancreas. Stress and pancreatic health are actually quite commonly related. What I see most commonly in my practice is someone with like a very sluggish digestive system where they're having struggles with feeling abdominal pain, indigestion, and what we find is that high levels of stress have downregulated their digestive function and have caused some of these symptoms. The thing that I think is most surprising for people that come to see me is the person that has been seeing me for years that has had amazing cholesterol and suddenly their LDL goes through the roof. And this is typically coinciding with change in hormones for women or perimenopause. So the rise in LDL in perimenopause is specifically related to the loss of estrogen. Estrogen has a protective effect on the cardiovascular system, and as women move towards menopause, they lose that protective impact and start to see a rise in their LDL levels. So this is a really important time to have more regular assessments of your cholesterol health. So as you approach perimenopause, you're going to see some surprising things with your cholesterol, especially if you're someone who had perfect cholesterol their whole life. You may start to see that your LDL goes up, your HDL stays about the same, and your ApoB really increases along with your LDL. So as a woman in perimenopause, if you're thinking about how to mitigate your risk around cardiovascular disease as you see your cholesterol numbers rising, you really want to be mindful about decreasing your saturated fats, getting in your fiber, decreasing your consumption of processed food and sugar. But honestly, you may want to talk to your clinician about hormone replacement therapy or estrogen, which specifically has a positive impact on your cholesterol markers. So genetics is actually more important than we think when we think about cholesterol. And I see this every day where someone comes to me and they exercise and they're eating perfectly, and yet they just want to pull their hair out because their cholesterol markers are not perfect. And in the end, so much of this is influenced by genetics. And therefore, it's important to take it seriously, but also with the energy of kindness and acceptance. I think if you're someone who genetically has high cholesterol, you may want to be a little bit more assertive with your clinician, because although all the dietary things, thinking about saturated fat and processed food and exercising are still important, they may not move the needle for you like they would for someone else. And so here you may want to have a conversation about what medications might be useful for you to use to modulate your lipid levels. The thyroid is an important gland that sits inside of your neck, and it is crucial for managing metabolism. It plays a role in the function of other hormones in the body. It is essential for your brain health, your digestive health, and essentially for you to feel well day to day. So the thyroid is essentially setting a regulatory mechanism of how fast or slow things run. It's going to control the thermostat of temperature. It's going to help our body know what's the rate at which we do things essentially. TSH stands for thyroid stimulating hormone. It's essentially the hormone that gets secreted from your brain to the actual thyroid, and it's asking your thyroid to do work. It's asking it to make thyroid hormones. The two main thyroid hormones are T4 and T3. And essentially the way it works is TSH knocks on the door of the thyroid, it asks the thyroid to work, the thyroid will make T4, and T4 then gets converted into T3. T3 and T4 essentially do all the things that allow us to function. They help with our basal metabolic rate, they help with energy, brain function, mood, they support our digestion, they manage the control of other hormones like cortisol and sex hormones, so it's essential. So in a blood panel, when you're looking at thyroid function, typically people will first look at the TSH, or the thyroid stimulating hormone, which is that hormone that comes from the brain to the thyroid. And here, when you're looking at this marker, there's a range that is considered optimal. When you are too high with TSH, you might be thinking that your thyroid is underperforming, because there's a feedback loop by which the brain talks to the thyroid. If the thyroid is not responding, the brain starts yelling at the thyroid and the number goes up. Alternatively, if the TSH is low, it means that there may actually be too much thyroid that's being produced, and it's telling the brain, hey, back off, stop yelling at me to produce because I'm done. So typically a high TSH, which actually correlates with low thyroid function or hypothyroidism, may be caused oftentimes by an autoimmune condition. It can also be exacerbated by nutrient insufficiency. So specifically here, I think about selenium, iodine, zinc, vitamin D, when we think about nutrients that affect the thyroid. And lastly, stress or adrenal dysfunction can worsen the function of your thyroid. Adrenal dysfunction essentially refers to the strength of your adrenals, which are two little, kidney-sized things that sit on top of your kidneys, and they manage the production of cortisol and DHEA, so they're very highly connected with your stress response. And when your stress response is elevated, you downregulate the function of your thyroid. So low TSH, remember, is actually more hyperthyroidism, where the thyroid is overactive. And here I think about stress as a driver as well. Typically, this is also an autoimmune condition, so we think about immune health and autoimmunity. And finally, some kinds of toxins can actually turn on this more kind of autoimmune function of the thyroid that may make you more hyperthyroid. So again, high TSH or low thyroid functioning, hypothyroidism, you may see weight gain, depression. You may see things like digestive slowing, as seen in constipation. You may have trouble with temperature regulation. Those are probably the most common things that people struggle with. With low TSH or hyperthyroidism, you may struggle with anxiety, irritability, insomnia. You may be insatiably hungry, but actually are losing weight. If you have low TSH or more of a hyperthyroidism, you may want to work with someone who is very skilled in understanding this conditions because it's nuanced. There are medications that can help slow down the production of thyroid hormones that you could use. You can also think about supporting gut health as the immune system sits inside of the GI tract, and as we balance the immune system, you can sometimes see improvements in this very highly autoimmune driven condition. And finally, you can think about stress management. If you have high TSH or hypothyroidism, the first thing I always think about is ensuring your nutrient status is really, really good. So here I would want to look at micronutrients like your selenium, your zinc, your iodine, and then actually looking at both vitamin D and vitamin A, which helps support the efficacy of thyroid hormone delivery. The most important lifestyle things I would say are related to stress management. So as stress is elevated, this drives up inflammation. The thyroid is an incredibly sensitive organ and it can worsen thyroid function when stress is high. The other thing that I would think about is essentially being cautious about any kind of excessive exercise or excessive dieting, which can put a stress on the thyroid. Most commonly in my clinic, I see an autoimmune-driven hypothyroidism, so low-functioning thyroid, where people are struggling with weight gain, brain fog, and depression. When I see someone with hypothyroidism, I first want to be curious about what's driving it from an autoimmune perspective. So I will look at thyroid antibodies to see how high those are and start thinking about supporting the gut, thinking about supporting the immune system through probiotics and balancing any infections that might be in the GI tract. I also will support those nutrients that we talked about, so the selenium, the iodine, the zinc, the vitamin D, the vitamin A, to support that kind of thyroid function. And then looking more closely at cortisol and seeing how cortisol and stress can be balanced to have a more positive impact on the thyroid. Weight and thyroid health are very much connected. I would say behind metabolic disease, this is the most common reason why someone might be struggling with weight. So as your thyroid is lowering in its output and function, you'll have trouble with maintaining your metabolism, and therefore you will be more likely to gain weight. So iodine is an essential nutrient that the thyroid needs to essentially make thyroid hormone. It's literally involved in the processing of the thyroid hormone to create the package that turns into the hormone that's secreted out into your body. So iodine can be found in iodized salt, although my favorite way to get iodine would be to focus on sea products. So like your kelps, your seaweeds are great ways to get iodine into your diet. So people come to me all the time talking about their desire to get off of thyroid hormone. And as a functional medicine doctor, I'm really passionate about helping people reverse conditions. But at the end of the day, you can't just take off your thyroid hormone without really assessing, is this going to have a negative impact to your health? So one thing that I want people to understand is if you're early on and if you're thinking about preventative health and if you're checking your levels regularly, you may catch a window where you could actually prevent a thyroid condition from happening. But if you've been on thyroid replacement for 25 years, the likelihood that you're going to just be able to stop and no longer have a thyroid condition is honestly unlikely. A full thyroid panel essentially refers to thinking about every single marker involved in your thyroid. So that would be a TSH, a free T4, a free T3, a reverse T3, a thyroglobulin antibody, a TPO antibody. This allows you to see every aspect working of the thyroid. And I think certainly if you are a woman, this might be more interesting. And if you're struggling with forms of fatigue that haven't been assessed or kind of elucidated through other biomarkers, this might be also a reason to do it. And finally, if you're someone with hypothyroidism that's on thyroid replacement and still feels horrible, you may want to look at a full thyroid panel. Weight can be caused by many things. And I think typically women come to see me and they assume that it must be their thyroid that is out of whack and that's causing their weight issues. But in fact, it's not always the case. And more commonly, I see some forms of subtle metabolic dysfunction that is causing weight and body composition changes before I see a thyroid issue as common. Metabolism interacts with literally every cell in the body. It brings in food and turns it into energy so that we can function. Mitochondria are arguably one of the most important components of our bodies and our cells. They take nutrients and turn them into energy. Without mitochondria, we would literally not have energy. On a very simple level, if your mitochondria are not functioning, you may struggle with brain fog, fatigue, weight gain, and many other things. So your mitochondria are incredibly sensitive to environmental cues. So excess stress, environmental toxins, poor metabolic function, these are all things that can compromise the function of your mitochondria. Insulin resistance refers to a situation in your body where your cells kind of go into a protective mode when there is excess nutrient or calorie around and essentially block glucose coming into the cell. And insulin, a hormone that is responsible for bringing glucose into the cell, has to work harder and harder to keep glucose stable. In a situation where you are insulin sensitive, your body can handle glucose that comes in, an insulin signal will be released, you swiftly bring in that glucose into a cell, and you pop out energy without any issues. When you are insulin resistant, your body may have some blockages on interacting with insulin that will compromise how well you make energy. Insulin resistance can be caused by foods, so focusing on foods that may be more processed, high in sugar, and/or a lifestyle that is incredibly sedentary. We can improve our insulin sensitivity by being mindful about limiting our consumption of highly processed sugar, processed food generally, increasing our consumption of fibers, making sure we're moving on a regular basis, and getting good sleep and managing stress. It's important to not villainize carbohydrates because they are important and essential for our health as well. However, carbohydrates that are more processed or refined, so think a croissant, or a juice, might be less favorable than a sweet potato or a whole grain bread. Metabolic syndrome is essentially a condition where people can struggle with between 3 or more of the following concerns. They may have elevated triglycerides, elevated glucose, low HDL, elevated waist circumference, or hypertension or high blood pressure. Considering 93% of Americans struggle with metabolic dysfunction, this is really important to look at. So when I think about metabolic health, I'm thinking about a few key markers: the hemoglobin A1C, a fasted glucose, a fasted insulin, a uric acid level. The difference between fasting glucose and A1C is the A1C is going to give you more of an average of your glucose over a period of time around 2 to 3 months, whereas a fasted level is giving you a static measure in the moment when you take that lab draw. A fasted insulin is a test that is done typically also after an overnight fast, and it is the amount of insulin that is required to keep your blood sugar stable. Now, what's interesting is if you are not eating any food overnight and grabbing that level, technically speaking, your insulin should be on the low hand if you haven't consumed anything. But if it is higher than we expect it to be as ideal, we know there may be some insulin resistance on board. So fasted insulin can give us a window into if you might be struggling with insulin resistance. The higher your fasted insulin is, the more that your body is working to keep glucose stable in the body, which is a communication that insulin resistance is on board. I would argue that fasted insulin is the most important early indicator of metabolic dysfunction because insulin is controlling your glucose. If you have metabolic dysfunction, your insulin may be creeping to keep your glucose controlled, and you may find that your glucose is totally normal and your hemoglobin A1C is also normal. But your fasted insulin will give you the earliest clues that insulin resistance is starting. Uric acid is a byproduct of purine metabolism. It was historically thought of in conditions like gout, but we now understand that it's a key player in the health of your metabolic system and also in your cardiovascular system. Increased levels of uric acid will put you at risk for cardiometabolic disease. Purines are breakdown products of protein. You'll find purines most commonly in animal protein as well as fish. So uric acid is increasing inflammation in the body. It's negatively impacting our cardiac health, our kidney health, and our metabolic health, putting us at risk for diseases. Uric acid has a direct relationship to blood pressure and may be the root cause for hypertension itself. If you have a high uric acid reading, the ways to improve that or decrease that uric acid level will be by, first of all, staying hydrated. Second of all, decreasing your consumption of fructose-rich items. So this could be your sugary drinks and sodas, alcohol as well, particularly beer, and decreasing your consumption of purine-rich foods, which would be your animal proteins, your red meat, as well as seafood. If you have a high fasted insulin level, I would recommend thinking about things like exploring intermittent fasting, and really looking at your diet to see if you can eliminate processed sugars, highly refined sugars, and thinking about increasing more fiber and protein to balance out the carbohydrates you are eating. Stress and sleep have an impact in your metabolic health, specifically through the mechanism of cortisol. So as cortisol increases, this is a stress hormone that will actually tap the liver to say, we're stressed, and as a response, the liver will dump a bunch of glucose into the body, which to the body is glucose, whether from food or from stress. So managing both sleep and stress is very important in keeping your metabolic health sound. So if your A1C or your glucose is high, but your insulin is low, this is still a communication that there is dysfunction in the metabolic system. In the end, our bodies are not perfect machines. And so sometimes you'll see markers shift earlier than others, but in the end, we want all of these markers to be balanced to have good metabolic health. When I see a patient that has high glucose, high hemoglobin A1C, but a normal insulin, in the end, I still think of this as a form of metabolic dysfunction. Our bodies don't work like perfect machines, and even when we understand physiology, it may not kind of come out the way that we expect it to, and this is still a communication that this system is out of balance and needs our attention. Luckily, many of the metabolic health markers like hemoglobin A1C, glucose, and insulin are quite movable. Now, this is not without effort, but if you are engaged and thinking about nutrition and lifestyle, you can actually reverse much of the dysfunction that can be seen in these situations. So if some of your metabolic markers are out of range, certainly in the early stages, you might struggle with insulin resistance, which could just be kind of like fatigue or cravings that you're dealing with. As this moves along, you may struggle with obesity or diabetes and or conditions that are related like polycystic ovarian syndrome or gout. Nutrients are essential compounds in the body. We need them for literally every biochemical reaction that our body is going to do to help support our function. And that includes brain, hormones, cardiovascular health, and energy, generally speaking. When we blood test nutrients, we are looking at the level that is present. And so here you can kind of get a sense, is there at least a sufficient amount and or is there an optimal amount? And how do those nutrients potentially relate to each other when that's relevant? Omega-3 and omega-6s are part of the essential fat category that we have. Omega-3s are specifically anti-inflammatory, and they are kind of harder to seek out in our diet because we have to be strategic about consuming them. You're going to find them in your cold water fish and in products like walnuts or flax seeds as well. And they provide this soothing anti-inflammatory effect on the body and have potential positive outcomes with respect to cardiovascular disease, brain health. Omega-6s are more ubiquitous. They are going to be found in some of our oils like canola oil and many packaged foods, generally speaking. In our diets, we tend to have lots of omega-6 influence, and generally speaking, they are more pro-inflammatory. So it is really important to think about the balance of the two. Ideally, you have more omega-3s than omega-6s in your diet to have a healthy lifestyle, a healthy life, and longevity as well. Omega-6s are not inherently bad. In fact, we want them present. We just want the presence of omega-3s to ideally be higher than the presence of omega-6s. In the US, Americans tend to have almost a 20-to-1 omega-6 to omega-3 ratio, and really we would like more like a 1-to-1 ratio, or even better if omega-3s were slightly higher than omega-6s. So you can get blood markers that will break down your omega-3 byproducts. Specifically, you might want to look at DHA and EPA that both have this positive anti-inflammatory role in the body. So you may look for, again, the balance. You want to see higher levels of omega-3s, the DHA and EPA, and lower levels of things like arachidonic acid, which is more of an omega-6. So iron and ferritin both refer to kind of how is our iron status in the body. Ferritin is a storage form of iron, so it's the backup reserve of iron we have stored in our liver, and is important when we're thinking about diseases related to excess or iron overload that can be a risk factor for cardiovascular disease. Iron generally is involved in the oxygen carrying capacity of your red blood cells, so it's important for energy and protection against anemia. Anemia is a condition where there is not enough capacity of the red blood cell to carry oxygen to the tissues. So iron and ferritin levels are going to be supported by animal products that are rich in iron, and or if you're not someone who's eating animal products, you can think about supplementing or increasing your consumption of vitamin C, which is enhancing the absorption of your iron that you consume. So oftentimes in women, you'll see iron levels that might look sufficient and ferritin levels that look low. And this is because given women menstruate, we lose iron regularly, and that storage or backup form of iron might be overall lower, but we're supporting the most important thing, which is iron in the red blood cell, and we keep that relatively steady. In a situation where someone has normal iron levels but low ferritin levels, I may still encourage nutritional forms of iron, but I also consider supplementing. Vitamin D is a hormone that actually has an impact on lots of systems in the body. It's going to regulate bone health and metabolism. It's going to be protective for your brain, generally speaking, and plays a role in the immune system. Low vitamin D might be connected to bone disorders, so osteopenia, osteoporosis. You may be more at risk for mood disorders and depression, and or have immune issues making you vulnerable towards infections generally. Vitamin D can be affected by being in the sun. So if you are someone who is lucky enough to have that influence through the sun, you can create more exposure or give yourself more exposure to the sun. Some people are resistant to that mechanism, and therefore supplementing with vitamin D capsules and or thinking about fortified foods with vitamin D can be helpful. So you can find some vitamin D in milk products as well as animal products. So animal protein in general tends to have some vitamin D in it. Vitamin B12 plays a role in your red blood cells, in methylation, DNA methylation, as well as plays a role in energy and brain function. So the B12 reading on a laboratory is quite large in range. Therefore, if you are truly deficient, you may have trouble with nerve function, you may have neuropathies, you may have depression, you may have low energy, but sometimes even when you're mid-range, you may struggle with mood disorders or lowered energy. B12 is primarily going to be found in animal products, so consuming those certainly will help. And if you are not somebody who consumes those, then supplementing with B12 is a very easy backup solution. Homocysteine is a marker that is involved in B vitamin metabolism, so it plays a role with B12 and folate, and actually is independently a risk factor for cardiovascular disease when elevated. So we look at it both as an assessment of kind of B12 and folate status, but also independently as a marker for cardiovascular health. So part of that is like people have different ways, like they can have genetic SNPs in what's called methylation, which is like that whole B and homocysteine like metabolism. And people that have genetic SNPs are more likely to not move their homocysteine out of the body. It elevates, and that's this kind of like independent risk factor for heart disease. Zinc, first of all, is important for skin and hair, for hormone health, and for your immune health. We mostly worry about zinc when it is low. Here we think about you may have trouble with hair loss, with skin disorders, you may have trouble with your testosterone production and or a lowered immune system. The most important thing I would say to think about if your zinc is low is to think about getting it from your diet. My favorite source of zinc would be oysters. So the most common nutrient issues I see in my patients would be, number one, lowered B12. And this is because the reference range on B12 is so large. And so many people go to their primary care doctor, they get this number tested, it looks normal, and they're sent along their way. But unfortunately, B12 is really optimal when it's sitting around 600 or higher. So helping people identify that and getting the right support when it's kind of suboptimal but not deficient, I think is really important. Number two, I see vitamin deficiency with D all the time. So D vitamin deficiency would be the number two thing I see very commonly and can be life-changing for people when supplemented or improved. So I see significant fatigue, brain fog, and hormone dysfunction as the most common things that people complain about and struggle with that can be positively influenced by addressing vitamin D deficiency. To be fair, the omega check level or the balance between omega-3s and 6s is routinely off unless I'm working with someone who is exclusively a pescatarian. And people get confused about this or even frustrated about this because many people will say, well, I eat fish 3 times a week. How is it possible that I don't have optimal omega-3 levels? And the bottom line is omega-6s are so ubiquitous that in order to create that proper balance, you really need to have a lot of omega-3s present. Cutting down omega-6 levels would happen by decreasing your consumption of processed food, being mindful about oils like corn and canola if you can, and then definitely just pushing the omega-3. So getting in your fatty fish, thinking about flax and walnut, and if you have to, supplementing. When we blood test, we're actually focusing on micronutrients. Micronutrients are, the small compounds, your omega-3s, your vitamins, your minerals that affect health, which is distinct and different from your macronutrients, which include protein, fat, carbs, and fiber. A urine panel can give us information about fluid balance, can give us a window into certain conditions that may be cross-checked through urine, like kidney disease or metabolic disease. But maybe most importantly and classically, we look at urine to understand if there's a presence of infection. The most common infections you'll see reflected in a urine test is a urinary tract infection that tend to be more common in women and typically bacterial in nature. A UTI may present with burning with urination, urgency with urination, and generally like lower abdominal pain. When I'm concerned about a urinary tract infection, I'm specifically looking at white blood cells, leukocyte esterase, nitrites, as well as bacteria specifically. The presence of white blood cells essentially just communicate that there's likelihood of an infection present. White blood cells are immune cells that tend to fight infections. Leukocyte esterase is an enzyme that will get elevated as a function of white blood cells being present in urine. So when we see a leukocyte esterase being elevated, we know 1, white blood cells are around, 2, there's an increased likelihood of infection. So nitrites are byproducts of bacteria that really are only going to be seen when bacteria are present. So when we see elevated nitrites, this is one more indication that you have a urinary tract infection. When you see these markers present, so the white blood cells, the nitrite, the leukocyte esterase, you're going to be pretty suspicious when you see those in combination with someone who has symptoms that you have a urinary tract infection. So when I look at a urinalysis, when I think about how to correlate that with kidney health, I might look at both protein. So excess protein in the urine may be a sign that the kidney is not having proper filtering capacity. I also look at other markers like glucose when I'm thinking about the presence of metabolic dysfunction. Glucose really shouldn't be in high levels in the urine. And when it's spilling into the urine, it's essentially saying, we've reached our load of glucose in the body and now it's starting to spill into the urine. Glucose has an independent negative effect on the kidney as well. And so both of these things give us window into the fact that there's metabolic dysfunction present. So hydration can be assessed through color and characteristics of urine. You may see kind of a hydrated person might have kind of pale yellow urine. Darker urine might be an indication that you are dehydrated. You can also look at sediments to see if they are kind of highly present or not. And when you see these numbers out of balance, you might be concerned about dehydration. If you're someone who struggles or has a UTI, you might think about preventatively making sure you're properly hydrated and consuming products with cranberry or D-mannose. If you have an active urinary tract infection, and especially if you're symptomatic, you want to talk to your clinician, as getting on antibiotics is probably the most effective route to eliminate the infection. So generally speaking, the kidneys and urine are obviously quite connected. So when you're thinking about how to support kidney health, you want to be mindful about metabolic types of practices. So keeping sugar balanced, you want a kind of balanced amount of protein that you're consuming, whole foods, hydration. These things can support your kidney health and therefore be reflected positively in your urine. Yeast is a type of fungus, and so you may find yeast in your urine, sometimes in women if they're struggling with yeast infections, but it can also be seen in people who might be immunocompromised and/or people that are struggling with diabetes. When we're thinking about genders and urine panels, it might actually be the case that a little bit of bacteria in a urine sample is considered normal and not concerning in a woman as opposed to a man. Because of the way our ureters work, our urethras are much shorter than males' urethras, we tend to have a little bit of reflux that comes as far as bacteria goes in our urine that can be considered normal. The complete blood count essentially gives us information about certain cells in your body and can give us a window into understanding oxygen carrying capacity. It may clue us into potential nutrients that might be off. It's involved in your immune system and therefore gives us kind of lots of areas to look at when we're thinking about your health. The health of our blood is supremely important because blood essentially carries things throughout our body, and without it, there's no delivery system to get things to where they need to be. And specifically, some of the blood markers give us information about oxygen carrying capacity, certain nutrients, how dialed up our immune system is, and if potentially we're dealing with infections. So the key markers that I'm looking at when I look at blood counts would include the RBCs, the hemoglobin, the hematocrit, and the mean corpuscular volume. RBCs stand for red blood cells. So it tells us how many red blood cells are available. And here, this is kind of like part of our decisions tree to say, do you have enough or do you have too little? And too little may put us down a path to look at, do you have a specific kind of anemia? Red blood cells have proteins in them that actually carry oxygen. And so without sufficient oxygen carrying capacity, you may be at risk for anemia. So if you have a problem with anemia, it can vary in intensity. In the most extreme cases, you may have trouble with actual breathing. You may be short of breath. In more, subtle cases, you may just have trouble with fatigue. Hemoglobin is a protein that has the capacity to carry oxygen. We need oxygen to be delivered to the entirety of our body to run respiration in our body. So hemoglobin can be out of range for quite a few reasons. Some of them are genetically determined, but they also could be low secondary to nutrient deficiencies that are things that are more in our control. So when I'm thinking about anemia, first I'm going to look at the red blood cell. And if this number is low, then I'm going to look at the hemoglobin and hematocrit. And if I see that these numbers are also low, then I want to determine what kind of anemia it is. I might look at the MCV, mean corpuscular volume. If that number is high, I'm thinking more B12 folate. If that number is low, I'm thinking more about iron. Hematocrit is the percentage of hemoglobin in the red blood cell. So it's telling us how much overall as a percentage is there versus how much protein is there in the red blood cell. Platelets are specialized cells that are involved in clotting, and you want a good balance of these to be able to protect you. If you have a wound, for example, you want platelets to come in to make sure that they can stop the bleeding in a reasonable amount. We also don't want platelets to be too excessively active because this can actually increase clotting in a way that can be detrimental. So platelets are somewhat governed by vitamin K, which is a vitamin that kind of supports the platelet production, but otherwise this may be somewhat kind of constitutional, like where your body is generally speaking, and or if you're getting kind of upregulated due to certain infections or inflammation. If your platelet counts are really out of range, this is probably a sign for you to consult with a hematologist, because typically kind of extremes on this are things that need to be worked up. So to support optimal blood health, we want to think about those key nutrients that are balanced. So your iron, your folate, your B12. It's also good to think about generally supporting the immune system with vitamin D and balanced omega-3s. And here, as always, your lifestyle is really important. So thinking about sleep, healthy, balanced eating, and stress management can be important as well. You would look at the blood count, generally speaking, when you might be thinking about more acute infections. So you might look at a white blood cell level if you're thinking about somebody who has an acute infection to trend that white blood cell level over time as we're treating an infection to see it come down. Alternatively, or on the other side of that coin, very low white blood cell levels, when they're not extremely low, where you're thinking about immune disorders, can be a sign of excess stress or immune dysfunction like autoimmunity. Immune regulation essentially refers to the concept by which the immune system, which is essential, is protecting against external pathogens or toxins, but also not overreactive to self. And that can be excess inflammation or even autoimmunity to the self. And it's a very delicate balance that you want to keep. In the extremes, you would see someone that is, having a autoimmune condition and or someone who cannot seem to fight an infection to save their life. The markers that I think about include neutrophils, lymphocytes, monocytes, eosinophils, and basophils. And these are all types of white blood cells. Lymphocytes are specialized types of white blood cells that are involved in adaptive immunity, which is kind of a second wave of the immune response, and tend to kind of focus primarily on viruses. So a lot of these markers give clinicians clues into, is there a certain type of pathogen that you might be dealing with? It's less about out of range, it's more like, if someone is like super fatigued and their lymphocyte level is elevated, and I can't really find an obvious reason otherwise in the blood testing, I'm going to start being curious about like doing deeper dives on viral markers, because that lymphocyte level is telling me there might be a virus here. We use these subtypes of white blood cells to look at shifts, is how we think about it, in the overall profile of these specialized white blood cells. So if I see the lymphocytes are unusually activated, I might be thinking, this person is dealing with a virus, and it will help determine my next steps when thinking about how to work up the problem. Monocytes are specialized cells that actually have a very specific cytokine or inflammatory release, and they also are involved in the allergy response. So a monocyte reading may tell me that there are allergies present, and or high monocytes tell me that the inflammation system is really dialed up. Mostly it's information as a clinician to be able to know, what do I need to look for to deal with that root cause. It's less that I would treat a monocyte, but it's more that it would give me a clue into what to look for that might be afflicting my patient. The relationship between monocytes and other inflammatory markers is not always kind of congruent. So you may have an hsCRP that looks totally normal, and yet a monocyte level that is elevated, telling us there is some inflammation present, and more so it gives us a way to start digging deeper into why is that happening. None of the markers as related to white blood cells really tell you if you have an autoimmune condition or not. Typically, that is screened through an ANA or an anti-nuclear antibody, which gives us the first kind of like top line clue that there might be an autoimmune disease present, and then there's a whole host of very specific antibodies depending on the tissue that is being attacked to be able to assess if you have an autoimmune disease. Neutrophils are essentially the first line of defense in your immune system, so they're going to be activated first, and they often are dealing with bacterial infections. So if you see a shift in your white blood cells with elevated neutrophils, again, this is a way for a clinician to kind of have a clue that you may be dealing with a bacterial infection. Monocytes are a specialized white blood cell that actually do something called phagocytosis, which is a very fancy way of saying they eat bad stuff in your body. So again, this is a sign that there is some kind of process in your body that specialized immune cell needs to be active to clear up those like dead debris or cells that need to be removed. So if your monocyte reading is out of range, you may look for more specific ways to assess the specific pathogens. That could be, doing cultures, that could be doing additional testing to actually identify the presence of certain pathogens. Basophils are a specialized white blood cell that are involved in allergy, and they also send out a specific inflammatory signal through interleukin-4. A basophil might either tell us that you're struggling with allergies or that you've got your immune system kind of dialed up. If your basophils are elevated, you might want to start wondering about what kind of allergens could be present. That could be food sensitivities that are troubling you and/or environmental allergens. If it's more that it's a sign of inflammation generally, this comes back to being curious about what's the underlying reason for that inflammation, which probably is some type of pathogen. Eosinophils are another specialized term of white blood cells that are specifically involved in allergy, but also can be seen as elevated in parasite infections. So most likely I would think about, assessing if someone has allergies that can be supported or treated, but I would also follow it up with a stool examination to see if they do have parasites. Electrolytes are essentially minerals that are super important for hydration, for fluid balance, for our acid-base balance, and generally speaking, for important functions like nerve transmission, muscle health, and energy, generally speaking. If your electrolytes are out of balance, most commonly you're going to feel fatigued, brain fogged, and generally unwell. So electrolytes can be impacted acutely, and that's probably when you're going to feel it most intensely, but you can be chronically dehydrated, and that can chronically lead you to be vulnerable towards some muscle cramps, to a little bit of brain fatigue, to a little bit of trouble sleeping on just a much lower level. So I like to look at potassium, sodium, chloride, magnesium. Sodium is really important for fluid balance specifically. So it's keeping that blood volume in the right place, and it's going to help also control our blood pressure as well. So I am looking for that kind of sweet spot balance. Very high levels out of reference range values are going to make me concerned and put you at risk for things like hypertension or high blood pressure. But very low levels actually worry me as well, because this has a huge impact on brain and neurological health and can be a medical emergency if too low. Most commonly, very, very low sodium levels are caused by a condition called SIADH, syndrome of inappropriate diuretic hormone, which is often an unknown etiology on why, but essentially over dilutes sodium in the body, which, as I said, could be dangerous. Potassium is very important for our muscular contractions and plays a role in heart contractility as well. If you are low on potassium, you might be more likely to get muscle cramps. And if you're high on potassium, you might be suffering from irregular heartbeats or even arrhythmias. So most importantly, if it's high, you want to work with a clinician to understand why. If it's low, you can actually think about consuming foods like bananas or avocados to support your potassium levels. Chloride is very important in acid-base balance. So we think about this more in the context of how acidic or basic is the overall fluid in your body. So typically you're going to see low levels of chloride that are going to put you at risk for changes in the pH of your blood and your electrolytes. Magnesium plays an important role in the body. It's involved in muscular contractions, it's involved in your brain health, and it's also involved in bone health. And so healthy, robust levels of magnesium can actually support the health of all three of those areas. You can get magnesium from nuts and seeds, and you can even consider supplementing if that's necessary. When I think about electrolytes, I mostly encourage people to consume an electrolyte powder if they are involved in heavy exercise and can replete with both good hydration and a very simple electrolyte powder that might have a little bit of sodium, potassium, and chloride. There is a role of hydration in your electrolytes. So if you are dehydrated, you might actually see falsely positive elevations in electrolytes that may not need to be acted upon. On the other side, if you are overhydrated, you might see slightly lower concentrations of your electrolytes. Despite the fact that fluid status can play a role in the levels of electrolytes present, in the end, your body is working extremely hard to regulate these electrolytes and keep them in a tight range. So when we're thinking about sodium intake, I really encourage you to consume foods that may naturally have sodium in them and or lightly salt your food. But when we're thinking about kind of more problematic sources of sodium, this would be like a can of soup or any highly processed food that has a lot of excess sodium in it that is an unnatural amount of sodium for your body to handle. I would not say you necessarily have to take excess sodium, although I find in women that are struggling with adrenal dysfunction, so trouble with their cortisol system, they do tend to feel better when they're supporting their electrolytes because part of those electrolytes are being governed by the adrenal system. And people who are extremely active and sweating a lot also benefit from both hydration, but also a very simple electrolyte powder. So when you exercise, you are losing sweat, but you are also changing the profile of your electrolytes overall. Now, this is very tightly controlled by the body. The body wants to keep your electrolytes overall balanced, but in the end, you might be losing more sodium than is optimal for you to feel well, and bringing back some of those electrolytes can actually be healthful overall for you. I think this is probably related to how much you sweat. So if you're doing short bouts of activity and you are an excessive sweater, then that's probably relevant for you, but also for the endurance person. However, generally speaking, I think about it more for someone who is moving for long periods of time, like an endurance athlete. Stress has a significant impact on the body. If I were to pick the one thing that I would want to see improved for people when they're thinking about improving their health, it would be to modulate or manage their stress. Stress specifically can accelerate aging. It can have a negative impact on your immune system. It can contribute to symptoms like insomnia, anxiety, fatigue, and therefore it has a big impact on how you feel day to day. So acute stress is actually favorable. We want our bodies to respond acutely to things like you have a test tomorrow and you need to study for it, or someone cuts you off on the highway and you need to respond swiftly. These are important reactions to day-to-day things that happen in your life. On the other hand, chronic or pervasive stress can be more problematic, and it has its tentacles into everything. So it can negatively impact your mood, your energy, your cognition, your immune system, and generally the function of your body and hormones. When you feel it acutely, it's often quite obvious, right? You might have an elevation in your heart rate, you've got the release of certain kind of neurotransmitters and hormones like cortisol that are going to kind of shorten how narrowly you focus on something. They're going to make you incredibly able to run. You've got excess energy going to your muscles to be able to run away from something. And you may feel this very simply when you have acute stress. Chronic stress can sometimes be more difficult to understand. Now, you may have conditions like anxiety or insomnia or lowered immune capacity that give you clues that you're chronically stressed. But unfortunately, sometimes people become very habituated to that overall chronic pervasive stress and may not even recognize that there's a problem unless they ground it with some markers that we can look at to assess if stress is present in the body. One of the most important markers that we look at to understand if stress is present in the body is a cortisol level. And cortisol is one of the primary stress hormones that is going to be released when you're dealing with stress. Acutely will rise and fall, and more chronically can stay elevated and have negative impacts on the body. Essentially, it starts in the brain. Your brain senses that there is a problem, and your brain then will tell your adrenal glands, hey, there's an issue here, and your adrenal glands will release cortisol. And as it does it, probably releasing norepinephrine, these sympathetic nervous system neurotransmitters as well, and this will start the cascade towards either acute problem that can be resolved or chronically that may not be resolved and have the more negative health impacts. So when you move from acute to chronic, you essentially have a persistently high level of cortisol that stays up without resolving and coming back down. A cortisol blood test can tell us, are you in range, generally speaking, kind of either dealing with normal levels of stress or kind of low levels of stress, or if very elevated, may tell us that that stress system is chronically activated. If we see an out-of-range cortisol, we're first wanting to understand what are the main sources of this, and kind of very important lifestyle things, I would say, are fundamental to supporting the cortisol system. So that's eating a nutrient-dense, well-balanced diet, and ideally eating in some type of regular time frame to support your blood sugar. Really thinking about stress reduction. We can change the way we relate to stress by modulating things like our breath. So deep breathing really sends a signal back to the brain that actually things are okay. And you can slow down the secretion of cortisol as a result. Sleep also plays a role in your cortisol levels. Chronic sleep deprivation is essentially considered a stressor to your body. And the more that you are going without proper levels of sleep, the higher your cortisol overall is going to be. There's also a very interesting relationship between cortisol and glucose. So if you think about it, when we are releasing cortisol, we are probably under some form of threat or stress. And to our body, that threat typically is considered something that may need glucose to support resolving the threat. So whenever we release cortisol, or as our cortisol elevates, we also are releasing glucose at the same time. So here's a situation where in the absence of food, you may see rises in your glucose as a function of your cortisol rising. However, the relationship between cortisol and glucose is not necessarily a bad thing. If you're an athlete and you're about to do a sprint, you really want that stress response up and the dumping of a bunch of glucose so that your muscles can pull up that glucose and you can run as fast as you can. However, in the modern world, we are having these rises of cortisol because somebody cut us off, because someone was rude to us on social media, and our cortisol is rising and dumping glucose into the body, but you're not running a marathon. That glucose has nowhere to go, and it just ends up staying in your body, contributing to metabolic dysfunction. So, and if we think about stress from more of a biochemical perspective, stress, and as cortisol goes up, is also going to drive the mechanism of inflammation and oxidative stress. Inflammation generally is that, destruction of tissue such they're not performing as well as they should. Oxidative stress is when that tissue has now kind of decomposed, it's no longer in its best capacity, and the sum total of all of this is going to drive up disease risk and increase your overall mortality. Besides breathing, there are a few other things that we can do to reduce stress. A yoga practice can be very useful. Walking, being in nature, and being in community where you feel loved and cared for and seen. Finally, exercise is one that is really important, but in excess can actually drive up cortisol, so something that you want to consider with balance. My patients often will tell me that when they are feeling stressed, they want to go for an intense run. And while exercise is very important, when you're in an acute stress situation, doing a very intense exercise is actually just going to perpetuate higher levels of cortisol, which is overall the opposite of what you are trying to do. So instead, consider going for a walk or doing some gentle stretching as a positive indicator to support cortisol. Hormones are compounds that have an essential role to the vitality of your body. They are going to be involved in your muscle mass acquisition, your brain function, your bone health, and your overall well-being. So if we think about testosterone specifically, testosterone is going to be involved with helping with muscle acquisition, with libido, with energy, with brain, energy, function, cognitive aspect, and protection against mood disorders. So testosterone blood readings usually come in two parts. The total testosterone, which is the full amount of testosterone that is being made by the body, and the free testosterone, which is really what's more active or bioavailable in the body. So the free testosterone is what's actually being delivered into tissues and having a actionable kind of end organ effect. The total testosterone is really what's made, and in a man, you want some minimum amount in order to feel as though their free testosterone is going to be sufficient for them to feel well. There are levels that are considered more optimal depending on your age, and generally speaking, there is some decline as one ages. So the first thing that I would do if you had a low testosterone reading is to repeat the reading. And if it continued to remain low, your testosterone reading, things that you can do kind of that are in your control include assuming that you are making sure you're getting sufficient protein in your diet, strength training, supporting yourself with nutrients like zinc, magnesium, vitamin D, making sure that your diet is balanced from the perspective of sugar and whole foods. And if all of these things don't move the needle enough, then to talk to a clinician about considering testosterone replacement. The most common symptoms I see with low testosterone include tendency towards obesity or body composition changes, low libido, erectile dysfunction, mood disorders, and cognitive dysfunction. So generally speaking, we look at the total testosterone to understand, is this a person where we might consider supplementation? And 300 nanograms per deciliter is kind of that pivot point where below that number, we would really start thinking about, this is a person who would benefit overall. Numbers higher than that really depends on kind of a clinical assessment and determination of if it might be useful for you. People that are struggling with erectile dysfunction or brain dysfunction and or having trouble with some cardiovascular negative outcomes may actually benefit from testosterone. So your sex hormones are going to be supremely sensitive to lifestyle, specifically stress. The cascade for steroid hormones are going to start with DHEA and pregnenolone, which can go down through cortisol or be turned into estrogen, progesterone, and testosterone. And if you're pushing a lot of cortisol, you may have less substrate to go to these other types of hormones. PSA stands for prostate-specific antigen, and it is the specific marker that we look at to understand prostate risk. And here, the most important thing is the delta change in the marker. So if you're seeing a jump in PSA, this might be a reason for you to seek out talking to a clinician to do some additional testing to understand, is this something you need to be concerned about? PSA, or prostate-specific antigen, is a marker that will become elevated, telling us there's inflammation in the prostate that may communicate that there is a risk for prostate cancer present. Female hormones as a class of compounds are integral for women's health. They are going to be involved in day-to-day function like your brain health, your mood, your energy, but they also are going to be important for fertility, your menstrual health, your cardiovascular health, and your bones. If you're a female and you're going to get blood testing to assess your hormones, timing is crucial. So if you want to look at markers like FSH and LH, these are going to be more accurate in the first half of the cycle, or ideally day 3 to 5. If you want to assess the health of your luteal stage, then you're going to look at when you ovulate, which may vary for women, but in general may land somewhere between day 19 to 22 of your cycle. And here you may have more accuracy around progesterone, for example. And if you're looking at testosterone because it's highest right before you ovulate, you'll look at the window between, call it day 9 and 12 of your menstrual cycle. So when you're looking at female hormones, it's crucial to know when they are tested because the women's menstrual cycle is very varied and things are moving all the time. So you want to catch hormones at the right time to be able to properly assess them. So if you happen to be pregnant while you are doing any kind of blood testing, you want to be mindful to the fact that this is a time where you are naturally insulin resistant. So you are going to see higher levels of markers related to metabolic health. And generally speaking, your hormone levels, like your estrogen, your progesterone, are going to be much higher than what we typically think of as optimal. And that's totally normal. And keep in mind that the further along you are in your pregnancy, the more insulin resistant you may become. And this is actually favorable to properly help that child grow. And the most important thing to remember is once you deliver that child, most likely you will swiftly go back to your baseline. The only caveat to this is there is a cutoff after which too much insulin resistance can actually lead to a condition called gestational diabetes, which is not favorable and overall puts you at risk for diabetes later in your life. Estradiol is the most common form of estrogen that you will find in women. And it is incredibly important for us to feel good energy, good brain function. And with proper estrogen, we are going to protect our bones and our cardiovascular health overall. When estrogen is in excess, which you might see in estrogen dominance or sometimes even in PCOS or polycystic ovarian syndrome, you may have trouble with excessive weight gain, with irritability, and with low energy. Testosterone can be aromatized into estrogen, so they actually can be converted back and forth. Even though we think of estrogen as one of the most important hormones for females, testosterone is actually quite important for female health as well. Testosterone plays a role in our energy, in our body composition, and in our mood. When we're looking at estradiol, we're essentially trying to understand where are you overall. Generally speaking, there are certain ranges that are considered optimal based on your age, but after a certain point, it might be too elevated, and under a certain point, it may be so low that it's not protective for your bones or your cardiovascular health. If you're on birth control and are doing hormone blood tests, essentially I would say this is not a useful metric for you because it's not giving you any real information about what's going on with your body. So looking at a testosterone reading in a female essentially is giving you information about how much total testosterone you're making and what's available free to the tissues. We tend to think about testosterone more when women are having symptoms that may be an indicator of testosterone dysfunction. So this could be like very low mood, weight gain, difficulty gaining muscle, low libido. And this is kind of more commonly going to happen as women move towards perimenopause and into menopause. So testosterone replacement in women has become more in favor in recent years because generally speaking, we are now thinking more about the utility of hormone replacement as a general matter for women. And typically this primarily included estrogen and progesterone historically, but now we are seeing clinically benefits of women taking testosterone to also protect their bones, their muscle mass, and their overall mood and energy. Sex hormone binding globulin is essentially a protein that's most commonly involved in binding up testosterone. So think of it as an Uber for your testosterone. It's going to allow for the transport of testosterone in the body, but it also, when bound, makes it unavailable for use. Basically, like active breast cancer, people with blood clotting disorders, these are times where you might be mindful about not just like knee-jerking giving someone estrogen, but outside of that, it's all like risk-benefit analysis kind of thing. When estrogen is low, this can be a risk factor for osteopenia or osteoporosis. It also tends to have a negative impact on your cardiovascular health overall, so it's something that you want to pay attention to. For some women, it's totally fine, and for others, they may need replacement to support their health. There's a very big connection between cardiovascular disease and estrogen. As women age and we move towards menopause, we are steadily losing estrogen. And estrogen has a protective effect against cardiovascular disease, specifically supports our blood vessels, helps manage our lipids. And so when we are losing estrogen, we are steadily increasing our cardiovascular risk. And cardiovascular disease is still the #1 killer of women. So follicle-stimulating hormone is a hormone that's secreted from the pituitary, and it essentially is asking the ovaries to start maturing an egg that will eventually be released for ovulation. So there are two things that you want to think about when you're looking at FSH. You might look at it in the context of a menopausal woman to help us understand Is she dealing with ovarian decline? And you might look at it in a menstruating woman as part of a overall health panel for, is she properly signaling her ovaries to be ovulated when we're thinking about fertility? Luteinizing hormone is a hormone that's more involved with the actual ovulatory process. So you're gonna have a rise in luteinizing hormone as you get ready to send that egg out to be released into the body and potentially be fertilized. So luteinizing hormone is important both when you're thinking about women looking into fertility. It can also be looked at in the context of PCOS or polycystic ovarian syndrome, where we often see an elevation in luteinizing hormone compared to FSH, and maybe less relevant when we're thinking about women in perimenopause or menopause. So when we think about the orchestra of the menstrual cycle, your hormones are doing a lot of moving up and down, but the one that does a very steep rise is your luteinizing hormone. So within around 36-hour period, you'll see a steep rise in luteinizing hormone and a steep decline. And in this window, you are typically most fertile. So prolactin is a hormone in women that we think about related to pregnancy and lactation, and it actually is the hormone that causes a letdown response for you to have milk production for a baby. And that may be desirable in some situations, but prolactin can also be elevated and not be desirable. And typically this is happening either because there's a structural problem in the brain and or there are medications that are causing prolactin to be overly secreted. And in this situation, and in women specifically, it might cause ovulatory dysfunction that could show up as infertility or menstrual dysfunction. So you might find a low sex hormone binding globulin in conditions like insulin resistance or metabolic dysfunction. It may also be present with someone who's dealing with hypothyroidism. On the other hand, a higher level of sex hormone binding globulin might be seen in liver dysfunction, liver sluggishness of detoxification, and or in people with hyperthyroidism. So if you're a female that gets a high reading of testosterone, this may be an indication of PCOS, especially if you're also struggling with weight gain, with excess hair on your body, with hair loss on your head. You may want to talk to a clinician to look at the other kind of ways to assess PCOS to find out if this is something you're struggling with. So anti-Mullerian hormone is essentially a marker that tells us about our ovarian reserve. So how much capacity do we have for fertility? And higher levels here are going to indicate that we've got better fertility potential, and lower levels might communicate that we have lower fertility potential. So when we talk about the capacity and thinking about anti-Mullerian hormone or your AMH, we're really thinking about, do you have enough reserve of eggs that can be released in ovulation for your age? And if that number is low for your age, that may communicate that your capacity for fertility is a little bit lower than if that number is higher. So estrogen dominance is a framework that we think about when we're talking about, is estrogen in an elevated state compared to what's optimal? And there's a lot of debate between clinicians about whether this is real or not. When I see an estrogen level that's above 300 consistently, I start to be curious about, is this person dealing with an excess amount of estrogen? And we see these conditions very classically in health problems that are estrogen driven. So fibroids, endometriosis, fibrocystic breasts, as an example. So ApoE is a genetic marker that has multiple subtypes, two of which can be more problematic and put you at risk for cardiovascular disease or Alzheimer's disease. It's very important, if you look at a marker like this, that you do it in conjunction with a clinician or a genetic counselor who can help you interpret and understand how to take action on this marker.